We're gonna do this again. I'm sorry. We were on my system and not on Facebook. So now we are live on Facebook. So again, we are here talking about COVID-19, what it is, what it does. A lot of people have a lot of questions about what's going on. And I thought it would be a wonderful idea to have some beautiful folk that I know work in the system and know more about this than I do. So with me today, I have Dr. and Mrs. Rosalind and Michael and Rosalind Dulan. I always put the man first. And they are my first elders of my church, but he's also my doctor. And yeah, they're the dynamic duo, I call them, because they believe in God, and that is so much important these days. But they also run a practice, and they've been doing this for a long time. Also, Miss Dinah Callendar, she's here with us from the VA. I'll let her explain who she is and what she does. And also Whitaker, I almost said Dionne Warwick. Dorionne Whitaker, who's been with us before. And just wanted to let you guys know that we have the best of the best, I do believe, today. So as we go again, if you could guys start over again and tell them who you are and what you guys do in the field. And I do apologize for that.
Hello, everyone. I am Dr. Rosalind Dulan, in practice with my husband, Dr. Michael Dulan, for over 25 years. As I said before, we love education and sharing information that's beneficial for people. So believe in just educating people, because with education, you have power and you can make wise decisions. So not an expert on COVID-19, but are very involved in taking care of people that are impacted by this difficult disease. So want to share any information that we can to help people make wise, informed decisions.
Hey, everybody, Dr. Michael Dulan, here with my wife, Dr. Rosalind. Like you said, we've been in practice for a long time. We're family docs, trained at Ohio State, did our residency training in Dayton, and we practice in Lebanon. We do a lot of education at UC and Wright State and Ohio University, Kettering also. So just enjoy sharing information. So we're glad to be able to present, answer questions, and hopefully be able to just give some information on this difficult disease process.
Dinah.
All right. Hi. Hello, everyone. My name is Dinah Callendar, and I've been a registered nurse for 15 years. I do have experience in the ER, med-surg, long-term care. And at the VA, I work with our veterans who are transitioning back into the community, who suffer with substance abuse disorders and mental health disorders. And of course, with the medical concerns that go along with it. I am a nurse practitioner. I am a mental health psychiatric nurse practitioner, and I basically treat acute and chronic mental health disorders. We just offer med management, psychotherapy, because right now that's what our society needs. Basically, I treat the children, adolescents at UMCH Family Services. I provided care there. And we're just here to help, to get us through by the grace of God.
Wow. Miss Dorionne Whitaker.
Okay. Hello, I'm Dorionne Whitaker. I've been a registered nurse for 21 years. I think about 20. I dated from my child. I was pregnant with her in nursing school. So I've been a registered nurse for 21 years. 15 of those years were in critical care in the ICU department. Then I went on and got my master's in family nurse practitioner. Then a few years later, I went back and got a dual certification and got my postmaster's in the acute care. I did that because I see both inpatient and outpatient. And to be in the hospitals, I needed that acute care piece. So I went back to school and got that second part. So I have a dual certification. I currently work for a big health organization in Cincinnati. I work in the pulmonary department. So this has been a hard couple of years for me. I have my own clinic that I do out in Oxford. And I do a lot of respiratory issues, and then I do an inpatient rounding also in Oxford. there. I also do sleep medicine a couple of days a week. And I also cover, because I just love to work, I guess, I also cover our priority cares on the weekends when I want to do something extra. so.
I'm tired just thinking about
I'm
all
tired.
you guys do. I don't know how you do it. I mean, I don't. I know, Dr. Dulan, you guys are parents, so as well as Dinah. I know Dorionne, your daughter is grown, but how do you keep it together? How do you do all of this? Seriously, how?
I'm very structured.
Okay.
I know Monday is here, Tuesday is here, you know which day you got to be, and you put on that hat. And I actually like it because I feel like it keeps, I don't like to be bored, and I like to do different things. So I feel like I get a little piece of everything and get to wear different hats. And so for me, it works because I get easily bored. So this way I'm always doing something different with a focus. So for me, it works. It keeps me happy. So.
Dr. Dulan, how do you guys, because you're at church, seem like almost every day. So how do you do that and work? Oh my God.
We work together as a team. And I think one of the things that is very helpful is, as she said, some structure and allowing yourself to have Sabbath rest to rejuvenate yourself so you're ready to handle what God gives you that next week. So I believe in just that, taking that time to have your time with God, the rest that you get through the Sabbath, and it gives you what you need. So
yeah, I agree. I think that, just making sure you tap into your spiritual strength, your prayer, your devotion, those things really rejuvenate us and carry us through when we think we don't have our own energy. The God will provide us that extra lift that we need to keep us moving forward.
Right. Miss Dinah, you just had a baby not too long ago, so
exactly. And it like the Dulans were saying, teamwork. Kevin and I, we tag, you're it, babe. It's you. I'm going down. I mean, we even sleep in shifts at this point. Okay. I'm going down first, okay, and then
wow,
it's Grace. Yep.
Okay, so one of the questions that I sent out some questionnaires, and one of the questions that was sent out was what I thought everybody knew what it was, but what is COVID? Dr. Dulan.
Oh, okay. Well, so COVID is a virus. It stands for coronavirus disease of 19. So coronavirus is a virus family that's been out for a long time. Mm-hmm. So 19 is just the pandemic form of it. When COVID first came out, a lot of people had conspiracy theories because they looked on the Lysol bottle and they said, look, it says kill coronavirus. It is, how did they know? Well, coronaviruses have been out for a long time. This is just the one that came out in 2019 and has caused the pandemic, but the family has been there for a long time. So this particular virus that came in 19 has just been extremely transmissible from person to person. And unfortunately, in the human population, we had not been exposed to it. So we had no defense, no immune globulin already built up to protect us from this particular illness. But it's a viral illness called COVID because it was a coronavirus of 19.
Mm-hmm. So there was 18 ahead of it? Am I saying that
There's
right?
been a number of them. As we remember, there was a bird flu that was out, another SARS virus that was out a number of years ago that fortunately didn't have the same impact, but there is different coronavirus strains there all the time. It just so happens that this particular strain had not had a human host before. And so our bodies were not set to fight it like some of the other viral strains that we had encountered.
So what makes this one a little bit more difficult? You said it didn't have a human host. Can you kind of explain that? Without getting too
If anybody else wants to jump in, they can. If not, I keep going.
You're doing a good job.
Right. So this particular virus, it seemed to have some unique ability to attack a system called our angiotensin converting enzyme system. And that system, by the time it was able to warn us that the virus was there, the virus was able to replicate very, very rapidly. For us specifically as African Americans, the ACE system or angiotensin converting enzyme system is not a very strong system. In our Caucasian brethren, it is an extremely active system. So for African Americans, the difficulty and why we've gotten so sick is by the time our ACE system warns us and says, hey, something's there, this virus got millions and millions of copies already replicated, and that attacks our immune system. And our Caucasian brothers, their ACE systems just happen to be very more active than our system is, and it warns them at an earlier time period. Now, they got really sick also, but it just so happens for us, we got warned a little bit later. But we just didn't, for this particular viral strain, viruses mutate and change all the time. And for this particular mutation, it had just not ever been in humans before. And so we just didn't have immune globulins ready to fight the battle for us.
Or we didn't have what we didn't have was antibodies that would that would attack the virus to slow it down. So since we had not had exposure to it, we didn't have the protective antibodies that would come in and keep the virus under control. So as it replicated and increased in numbers, it caused inflammation and a destructive process in various organs. So that's why it's important for us to do things to help our immune system fight off the virus.
So does the virus work? I mean, does the vaccine work?
Absolutely. If
Yes.
we all can get vaccinated, that's the thing that I think with things that I've been a part of in our community, especially, is we have to kind of dispel some myths, because we've got history of things that made us very cautious of things that come out. And I was even cautious. And I'm in the medical profession. And I, at some point, said, when the vaccine's coming out, I'm going to wait. I don't want the first batch. I want a few batches in, and then working in an ICU and working, at the bedside, finally, when it was, hey, it's coming out, people who are, first line, here's the sign up. At that point, something just triggered. And I said, this is how we fight. This is my version of doing my part in fighting, because I've seen it. And I think sometimes I wish some people could see the things that I see to know that this is very much real. And it's something that I never want to have. It's not a way I want to be sick. It's not how I want to go. It's lonely. It messes with your mental health. It runs you to the ground. It fatigues you out. So it was a no-brainer that this is what I have to do to, I get the flu shot every year, and people say, well, why do you have to get a booster? Well, you get the flu shot every year. We have to stay ahead of it. So for me, it was a no-brainer. And this is the way that we fight this. And the only way to do it is to get enough immunity in our community to, prevent the replication so quickly.
So there's been the vaccine, and then there's the booster. Will there be another booster that's going to be needed? Or do you think there will be?
As long as we have a virus that continues to replicate and get variant strands, you will need a booster to help fight off the changes that occurs with the virus. So just like we have boosters for the flu shot, and people fixate on the COVID vaccine, there's multiple other vaccines that we have gotten throughout the years, and it's to help our bodies build up protective antibodies to fight off those infections. And we've been effective in eliminating certain things like smallpox and other infections because we have effective immunizations and antibody protection. So, but it's just been difficult. And I have to say this because instead of us managing this to the medical profession, infectious disease specialists, it became political and it became spiritual. When we deal with issues with cardiology, we leave that to the American College of Cardiologists to make recommendations on how we deal with cardiac disease. When we deal with other diseases, with cancers, we leave that to that discipline. But because this became political and then we made it religious, it took away from the focus of protecting people, doing what's going to be effective to rid the disease or to get it under control. You have people, with saying things with conspiracy theories that has nothing to do with treating the disease and getting it under control.
Dorionne, you mentioned something about the psych kit, and I know Dinah, you work in psychiatric health. What have you seen or is happening with our children dealing with this? I know, because I know they can't go to school. I know there's some woman that was on Facebook and was saying that people are dying because they're not being touched. Do you think that's because of the we can't touch anybody anymore? We got the fist bump. Is that really affecting our psyche? You're on mute, sweetie.
I'm sorry about that, but depression, that's what we're mostly treating now. The children are having panic attacks. We have to, give them something to help calm them down, just to make it through the day, What's going on? There was a lady in California. She lost her son, a 17-year-old son, because of guilt. The father, Mr. Rice, I think in California, he contracted COVID from going to an event that his son invited the family to. He passed, and the guilt of that, he took his own life. So that family not only lost the head of their household, now they lost their son. So it's intense. And sometimes you try as a professional and as a Christian, first of all, I want to present God. But of course, I have to lead out with the question, do you believe in God? How do I bring that into my treatment? Other than just pushing therapy, of course, medication. Medication is to help you get through the hump. Sometimes Christians feel as if, no, you got to have faith, no medication. Listen. If it's going to get prayer, yes, put God first. Follow the new start, nutrition, exercise to release endorphins, do your water, get your sunshine. Yes. After it's all said and done, you've done all these things, medication is fine.
Yeah. I think on the inpatient side, what I've seen two sides of mental health issues. I see the medical team, the nurses, the doctors who are working in the hospital, they're tired, they're drained. It's a lot going on. They're short staffed because you've got nurses. One of our hospitals, major hospitals, we have a staff issue because a lot of nurses either are leaving or they're leaving to go do travel assignments because they're making lots more money. And so we don't have staff, we have empty beds, and people say, well, there's an empty room. There's no one to take care of them. So that's one side. The other side that I see working in the inpatient world is where I primarily practice my inpatient is probably a more rural area, a lot of farmers, a lot of country, it's just a different world. And a lot of those people aren't vaccinated, to be honest, that I see out there. And so the community I work in Oxford, there is a huge university. So you've got Miami University, and it's like I see the spikes. As soon as the college kids come in, the people in the community are the ones who end up in my ICU, not the college kids, but they're the spreaders, in my opinion. And so what I'm seeing on that end, and it's something that I just can't explain, and it's terrible to go in and I'm assessing someone and I'm all garbed up. They can't see me, I got on a gown, 2 sets of gloves, I got 2 sets of masks on, a face shield, I got a hair cap, I got on shoe covers. I'm not taking anything home. And, to go in there, they can't have their family in there. They're on high flow oxygen, either a BiPAP or Vapotherm or OptiFlow. I talked to a guy, he's prone himself. We told him, you got to get on your stomach, buddy, and I'm trying to tap his back, and I'm getting on my knees and I'm talking to him because he doesn't have anybody to talk to, touch his back, touch his hand. And a lot of times they say to me, I should have got it. I don't know what I was, the remorse that I see, that they know that they've made an error in not getting vaccinated. and it's something you can't change at that moment. So we do a lot of, I try, even if I'm having a bad day and I walk in there, my day is not as bad as the person laying prone with all this oxygen blowing in their face. So I try to do a lot of touch, and maybe I should ask them that. But I try to touch their hand, touch their leg, or, touch their shoulder. We do iPads, so the family, and I said, y'all have to constantly be calling in here and talking. He needs to see y'all. He needs to hear y'all, or she, whoever. This is just something I did with a patient recently who had a 9-year-old at home, and he's 51, and he's got, I got a 9-year-old. I can't die, and, but none of them were vaccinated. So I feel like I have these stories a lot of people who said I woulda, coulda, shoulda, but this is why I didn't. And I always ask them, well, why didn't you? Because if I know the why, maybe I can in my clinic, like, focus on the things that this is why this particular person I'm hearing, hey, I'm usually by myself at work. I didn't think I was even a risk to get it, yeah, but you have an adult child that lives with you and they're all over the community. So if I know why some people aren't getting it, maybe I can focus on how to talk to my people in the clinic on why they should get it.
Yeah. Dr. Dulan, you have your practice. I know you mentioned that you had several people, and it is also, isn't there an urgent care next to you? Are you seeing a spike in the last?
Oh, yeah.
Yeah, the urgent care in the last, so connected to our practice, there's an urgent care. The last 3 weeks, there's been a waiting of about 20 to 25 people. And that's starting when they open at 8 in the morning until they close at 8 or 9 at night. There are lines of people. And in the virus, this Omicron variant, it's very easily transmissible. Unfortunately, like Dorionne has said, people, they just don't believe that they need the shot, or they got a shot, but they didn't think that they really wanted to get the booster shot. Or some people didn't get it because they didn't personally really know anyone that had gotten sick. But consistently in the office, we in our practice we've probably had about 30 patients die, since this started in 19. And consistently, people that come in, they said, you know what? I didn't think this was real. I didn't think I was going to get that sick. Or, my spouse passed from it and I wish we had listened. I've not had anybody say, you know what? I'm glad I didn't get the vaccine. I've not ever heard that. And so I would just encourage people, one thing I was going to say about what we talked about earlier was, some people's reluctance to get the vaccine was, they said this vaccine was made too fast. Well, it really wasn't made fast. What's happened with our vaccine technology is, think about it like a car. So GM may have a chassis that they construct that they use in a bunch of models of cars, okay, or Ford or whoever. It's the same thing with this vaccine. When the last coronavirus came out, they constructed a base to the vaccine that they're able to add in different parts of the antigen onto and create a new vaccine. So like back in the day, they had to make everything from scratch for all the diseases that come out. That is not the technology any longer. So there's a base that's there, something new comes out, they plug in these new pieces of virus on there, they test it, make sure that we get an immune response, and a new vaccine is created. It's not going to take years and years to create vaccines. And the other thing is, you got to look at it. This was the pandemic. So you had the best scientific minds all around the world at the same time working on creating a vaccine. This wasn't just one company trying to make something. You had the world coming up with, with these vaccines. So I would not be afraid that the vaccines are safe. We are not seeing hundreds of thousands of people die from taking the vaccine.
Right.
Like, that's not happening. There's some side effects, yes. Have some people got sick from the vaccine? Yes. But we're not seeing people across the board die from getting the vaccine, but we are seeing people across the board die from being unvaccinated.
Mm-hmm.
So we had, go ahead.
There's another misunderstanding that people have. Some people who get the vaccine they feel like they still don't have to protect themselves. They feel like they won't get COVID. You still can get COVID, but what the studies have shown that is when you have the vaccine, you're not as sick, and it significantly decreases your risk of hospitalization related to the virus. So people who have the vaccine and the booster, if they get exposed, they handle it because their immune system has antibodies to help fight off the virus, to settle it down so they don't get as sick. So even there's some misunderstandings with should I get the booster or how the vaccine works. So even with the vaccine, you still should wear your mask. It's the layers of protection that are going to lessen your chance of exposure or getting very sick with it. So just a lot of misunderstanding. And I think this is an excellent opportunity to just educate people.
What about wearing the mask the wrong way? I'm seeing a lot.
Oh, then it's not.
I mean, I'm not going to say I was at my church, but I was at a church the other day, and I saw someone wearing the mask, and it was just down here. I'm like, what is, I mean, and you can't tell them anything. I mean, what is that? Is that hurting that person, or is it hurting us around her? I mean, because we don't know what she has. So what do you say about that? I mean, how does the mask work? Maybe I can ask you that question.
So
what does the mask protect?
I don't know. Maybe I need to find a better analogy, but what I got at the moment, if you don't wear a condom correctly, what will happen?
Right. Boom.
This is, so if you don't wear the mask correctly, people say, like, I hear all the time, I work in pulmonary. All my people can't breathe on a good day. So they especially can't breathe when they got the mask on. So I hear it all day long from all my COPDers, I can't wear it. They already are towing the line of anxiety. When you can't breathe, you stay a little anxious. So those are my people, my normal folks. And so they're like, I can't do it. And I said, if one pneumonia, one exacerbation is all it's going to take and your lung function is done, I need you
can you
wear it. So maybe we need to find a different mask.
What is it? You said exacerbation what?
Oh, exacerbation, like a flare up. Like a flare up.
Okay.
Like if, people who have maybe a chronic condition and it's not controlled for that moment, so asthma, they're good, the seasons change, they have a flare up, they have more shortness of breath, stuff like that. We call that an exacerbation. Those are things we don't want to happen, because especially in my lung world, like lung function's gold. So every time you get sick, it knocks a little reserve or bounce back. Sometimes it doesn't happen. And so I tried to tell them the what ifs, look, you're on 2 liters every day of oxygen, or you've got sleep apnea, or you're obese, or you got a bad heart. If you get sick and come into these hospitals, your odds are against you. I need you to be well. And this is why. These are the things I need you to do. So even if you need to let's find you a different mask. Maybe that mask isn't a good mask. So I have masks I bought in bulk, and I'm trying to give them to my people, because the regular masks, sometimes they just don't need them touching their lips per se. So I have some, the different ones that are kind of like cone-ish, So I'm trying to give things out to people. You got to wear them. So let's figure out, maybe this isn't the right one, but you got to wear it. If you don't want to end up in the hospital, you need to wear it.
Yeah, if you don't wear the mask correctly, it defeats the purpose of wearing it. So the proper way to wear it is fit it over your nose and covering up your mouth. If it's under your nose, you're breathing in things, and you're also breathing out things that you expose other people to. But that's why I emphasize to people to protect yourselves. You need to wear the mask, get vaccinated, because you have to protect yourself against people who aren't going to do those things. So we can educate, but some people are still going to be resistant to doing that. But for the people that are wearing it under their nose, they really might as well just not put the mask on, because it's defeating the purpose of the mask.
I had 2 questions that came in, and they're kind of sort of the same. One asked, will the vaccine cause infertility? And the other was talking about, is it okay to get vaccinated if I'm breastfeeding?
Well, the recent CDC guidelines, oh, you can
Yeah,
go ahead, Dana.
I could answer. Per CDC also, and by my experience, yes, you can get vaccinated and breastfeed. You're passing that passive immunity to your baby. So that's the best, to me, that's the best way, especially the infants up until, well, it's five and
5.
under, you can't take anything. So that's how you protect your baby. So.
Yeah, so when you get the vaccine and you allow yourself to build protective antibodies, you're passing on, as Dina said, that protective immunity, which helps gives your baby some protection. They have had studies ongoing with pregnant females that have received the vaccine, and to this point, there haven't been any issues or concerns there. So,
Yeah, the CDC site says that there are currently no evidence that any vaccines, included COVID-19 vaccines, cause fertility problems.
Right.
No problems with women trying to get pregnant, and there's no issues with men and fertility either. So no evidence that there's fertility issues with any of the COVID-19 vaccines.
That's good. So how has COVID changed the way you practice, the way you live your life?
Well, basically for me now, it's through telehealth. Okay, yes, I could provide, yeah, I could prescribe antidepressants, but if you're gaining weight, I have to look to see, oh, okay, how do I weigh you? How do I check your blood pressure? Depending on the medication I'm prescribing, it has to be hands-on. And yeah, that's a hindrance.
I think for us, it's taken away, to me, you do telehealth, which I do it. I'm not a big fan of it because I like face-to-face contact. So it's taken away that. You're not able to shake hands and really interact with your patients. Touch is a big part of healing. It's a big part of how you connect to people. So now you practice kind of in a distant fashion.
Exactly.
Also, there's always, you have to protect yourself because you always are concerned that you could potentially have exposure. So you're practicing more defensively. So it's a very, very different way to practice. Never would I have imagined that this is where we would be at with all the technology and advanced stuff that we have, that we are not able to come together with the education and information that we have to do what's best to protect society at large. So you're practicing very different.
Yeah, we put some changes into our practice where we check people in from their cars now. We minimize the amount of people that are in our lobby. Pretty much you check in and you come right in and we take you into the room. And then when we check you out, you pretty much just go back into your vehicle. If you have upper respiratory type symptoms or any COVID type symptoms, we either do telemed or we do some exams where we come out to the car. So we have you stay in your car and we do your vitals in the car. We come out and we examine you in the car, which when it's cold or raining is a little tough, but we do it, because we don't really want people coming into the office with some potential COVID type things to get other patients sick. So it has changed the way, like my wife said, the way that you interact with people somewhat, but we try and keep other people as safe as possible. And like Dinah said, what you can treat through telehealth, we do, so that we keep people as safe as possible.
What are some of the symptoms of, because I as you know, Dr. Dulan, I've been dealing with this sinus issue forever. And I'm like, oh Lord, do I have COVID? Every time you get a sore throat, oh Lord, do I have COVID? And I just got these 4 tests that came out. So I want to use them sparingly, but it's if you have a symptom, you should take it. So what symptoms should I look for?
Well, that's the difficult part, and you guys, everybody jump in. So COVID, it mirrors so many different upper respiratory tract and allergic symptoms. So, Delta, the big thing was loss of taste and smell, burning in your nose, high fever, cough, fatigue. Omicron has some of those too, but a lot more people, it's been sore throats. I've been seeing a lot more sore throat symptoms, more allergic, just runny nose, not seeing as much lost taste and smell, cough, fever, fatigue, those things are there. But honestly, for a lot of people, it looks just like plain old Ohio allergies, plain old cold, cold. And I don't know how many people we've put on telehealth, and the first thing I say is, "Are you vaccinated?" No, or I got my vaccine, but it's been more than 6 months. So the 6 month thing is important because we lose about 6% of immunity each month with the vaccine. So by the time we get to about 6 or 7 months, we're down 40, 50% of protection. So that's why that booster is important to get you back up to 75 or 80%. But the symptoms are very similar to upper respiratory stuff that we get here commonly in Ohio. But if you have it, it's worthwhile to go get checked. So either get a rapid antigen test. The caveat with that is you need to give it a couple days. So if you get a sore throat today, don't get a test and test today. You need to give yourself a day or two. If you've come in contact with somebody that had COVID, quarantine, then take your test because you can get a false negative. And we've seen that over and over again. People test too quickly. They say, "Oh, my COVID test was negative," but then they're sick. And then a few days later, they go get another test and all of a sudden they're positive, but it's because they tested too soon. So give yourself a couple days before you do the antigen test.
And the other key to that is if you're sick, I do not go around people to expose them. I mean, that's the thing. Just because you test negative to COVID, there are still other viruses that you can spread to people that will make them very sick. We've been COVID focused, but you know, people get other cold viruses, rhinovirus. There's a whole list of them that you can still pass on to somebody who doesn't have a strong immune system, and they may not handle it well. So the thing is now with all of this going on, because sometimes we don't know, you know, if it's just a cold or if it's COVID, but if you're sick, stay at home. Don't go in large crowds. Don't send your kids to school, because then that's how we continue to deal with the spread of these infections, because people aren't being wise with those things. So even if it's not COVID, if you're running a fever, if you're sick, stay at home until you're better.
Seen a lot of that at churches. I mean, we've had, the Kojic church was hit hard last year. I mean, it was like 30, 40, 50 people dying left and right because I don't know why, but I know they were still having church, you know, as usual. And I look into the audience and they were still, you know, neck to neck, you know, arm to arm. What is it going to take for us as African Americans to get it? I mean, I know we've had a lot of families that have been sick. So what do you do when your husband is sick and has COVID and you're in the same household? What should you do? You can't be in the same bed, right?
I mean,
you have to quarantine. They say you have to quarantine, Jackie. Yeah,
you got to get. So my daughter, that happened to me. You know, I have my daughter's 21, and we live in the same. Even though she's got a side and I got a side. So you know, she recently had COVID, and I had just got my booster probably maybe a month prior to that. She's fully vaccinated, but she's not had her booster. We debate, and we having a moment about that. But she's 21, so she thinks she knows. But so you know, I had just got my booster, and she works in a daycare, so she's more prone because you know, she works in the little infant. They can't be vaccinated, so she's in a high risk area, and she gets allergies really bad. So that she's like one of those, and she's like, I just have. And I said, when we get home, I got one more test, sis. We're gonna do this, you know. And we did it, and she was positive, of course. And so I went and got tested a couple days, you know, because I work at a priority care, so I'm just, y'all just walk in and take care of me and see, you know. I never came up positive. After like day 3 or 4, I stopped anyways, because I'm like, well, my precautions aren't any different, and I'm I'm very particular about, who I'm around, and my patients I'm doing telemedicine. So after that, my symptoms I had some mild symptoms, but I never was positive. After day 5, I was better. There was no need for me to keep utilizing tests, when other people can use them. But I never came positive. But I think some of it, might have been the booster might have helped me with that. She was very sick for probably 4 or 5 days, like bad flu. What is like, Jesus is coming, I feel, mama, and I think the reason I maybe didn't get sick, or maybe it was the booster, but I think it's how every night I had my Lysol. Everything she touched, you're not allowed. We had to designate some rules. You can't go in the kitchen. You can't touch in my fridge. I will bring things to you. Text me, and I'm gonna leave it at your door. I think it stinks because even on day 2 or 3, my daughter was knocking on my bedroom door, and she says, this is what my 20-year-old, who acts like she's an adult, was like, I just need a hug.
Oh.
I love you, but we not gonna hug. And it was in that few days being home, she had been so isolated that she was like, I just need a hug from my mother. And I said, girl, bye, But I mean, me being very particular about the food and giving her stuff and washing things, and maybe that's why I didn't, I don't know. So I think we have to figure out, maybe someone has to sleep on the couch, and I know that stinks, but if you're like, especially, with you who just had a baby, if your husband gets it, you have to be good for the house. You can't get sick. And that's letting them understand, it's not that I don't care. It's not that I don't love you. We just got to maneuver differently because both of us can't be down,
Yeah, we both Rosalind and I got COVID early on, before vaccine was out and all that stuff. And we just separated. So I was the first person to get it and was sick for 2 weeks.
Oh,
And so she went into another room, and she would bring me a little something to eat or drink and just make sure that I was good. And, but we stayed completely separate until I got to a point. And then the same thing when, she ended up getting it. We just stayed separate. Once tested positive, moved and just stayed separate. And so, yeah, you check up on a person, call them, make sure they're good. If you need anything, mask up, glove up, drop it at the door, and you're there, to take care of that individual. But one person got to be good for the house. So you have to, make sure that you protect. The great thing now is that, there are some things that are there. There's some immune globulins that are there. There's some antiviral medicines that are available now. Some of them are in short supply. The virus has mutated a few times. Some of the original antivirals aren't working as well. So there's some new ones that have come out. But there are a lot of things. If you're getting more short of breath, if your fever's not breaking, if you're not able to eat, you're getting weaker, there are some things that some criteria you have to meet to get the immune globulins. But if you meet those things, there is some significant help that is there. So you don't have to stay at home and suffer if you're getting progressively weaker, if your oxygen sat is dropping. There are some help that can get you turned around in the ER and get you back home where you don't get admitted to the hospital. But there is some help that's there now, fortunately.
But you don't want to, some people are just saying, if I get really sick, I can just go to the hospital and get the immunoglobulins. Nothing works better than having your own natural immunity to help you fight an infection. So you don't want to not get the vaccine and rely on those, because like Dr. Dulan said, there's a short supply. We're having to conserve those things for people that are more sick, that are really not doing so well when they get the virus. So you really want to protect yourself as much as possible. Get vaccinated. Like I said, layers of protection. Do the other things just to help. And like I said, it may not be you, but you may be saving someone else's life by not exposing them, by taking that responsibility. That's where we have to be our brother's keeper.
And I just wanted to add on to that point that I'm seeing working in the priority care setting. We're getting people who test positive and they know they're positive. They took a home test, they positive, they know, and they come into my urgent care, my priority care. And the reason being they're not vaccinated. And I had someone who was a type 1 diabetic, a young man, he was unvaccinated. He was mildly symptomatic. So he's positive. He knows he's positive. He took a home test. He comes into the priority care and goes through all of us to get checked in because he wants to get a PCR so then we can order him the monoclonal antibodies. Okay. And so that was his protection. It was like, if I get it, I'm going to just do that and they're going to give me antibodies. Well, guess what? We didn't have any at that moment. I still did, because he had obesity, he had risk factors, he had type 1 diabetes. I just tell them, hey, here's a form about it. They're going to call you. Supply is low. Supply is low. I don't, it's not my job to say, no, I'm not going to order it. You meet the criteria, I will order it. But he didn't get it. And that was his, probably in his mind, if something happens,
yes.
I can just go get this. And that was like an aha for him. Like, what do you mean? Like, I have type 1, but he wasn't vaccinated. So I want people not to rely on them. They're there,
yes,
but the supply is so, he was just not very happy. Well, I wasn't happy he came into the priority care exposing that. But we see that a lot. People are coming in because they want a positive test. So then we'll order the antibodies for them.
Crazy.
Yeah.
It's a great point.
That's crazy. I'm just thinking about what all you guys do just to keep us safe. And my heart goes out to all of you. I don't know what's going to happen in the next few days. We trust God. We know that.
Absolutely.
But there's just some things that we can do better.
Yes.
And I'm praying that God will continue to put his hands around you and protect you from this and from folk who don't care enough to at least stay out there in the car, and get checked. Because I've been there. I don't mind sitting in the car. I rather sit in the car than be in the waiting room with a whole bunch of sick folk. But because you just don't know. And I'm almost that way because you got some people now that I've talked to, young older lady who's just afraid to go anywhere, and that's where my heart is.
Mm-hmm.
She doesn't go anywhere. Everything is delivered to her. But she's now feeling depressed. We've had one lady pass away, and it was just, we don't know if that's the reason, but she was like 75 years old, and she just never went back outside because she was afraid of this, afraid of that. I know we can't be afraid of everything, but this thing is serious. And the what I don't understand is the asymptomatic. If you guys just go a little bit on that, and I promise that'd be my last question.
One point I want to add to what you're saying, we are encouraging people because I'm seeing a lot of patients, as Dinah stated, that they're depressed because they haven't had social interaction. They've only left the house in very limited settings. So I'm encouraging them, especially as the weather lets up, get out and just get sunlight.
Yes.
Call people, try and connect, even if it's on your phone. Make sure you have some social interaction to connect with people, because that's so important, because then your mind goes and starts to just think of everything when you totally isolate yourself. So we are encouraging patients to do that. Now, for the asymptomatic people, those are people who actually contract the virus, but they don't show any symptoms of being sick. So because they don't have any runny nose or cough, they can go around and spread it to other people. And that's, again, why I emphasize layers of protection. If you're vaccinated, the mask is going to help lessen that you would expose someone. So they may not ever know that they have it unless they have to be tested for a job or tested before a procedure. So there are people who will contract the virus and may not ever manifest any symptoms of being infected with it. I don't know if you want to expand on that.
I mean, we all have different strengths of our immune system, right? So some people's immune system is extremely robust, and before the virus can replicate and cause significant system problems, their body has fought that virus, and so they don't get a lot of symptoms. There's some people who have a lot of chronic diseases like Dorionne sees with COPD and those things, or chronic renal disease or cardiac disease or diabetes, that their immune system is already struggling anyhow. And then you add a rapidly acting virus on there and they get all kind of symptoms. So asymptomatic carrier is a big problem, especially in our younger people who have really, really robust immune systems. And they may just have a little runny nose or something that's so slight, they don't even think it's anything, but they have plenty of active virus that they're spewing all over the place. So that's why the masking and social distancing and sanitizing, I mean, those things are still effective. We kind of have moved away from it, but those things are still very, very effective in keeping us protected.
Yeah, we talked about a lot, and I know there's still so much to know, and I've got a couple of questions about church stuff. We're going to do this again. We're going to have to bring some of y'all back. I'm telling you now, because folks are asking, what about church choirs? I'm like, we didn't say we was going to do that today, but we'll do it next time, I promise. Because folks want to know, is it okay? They're dealing with the droplets and what's the right type of mask? Do these singer masks really work, or is it just a ploy? There's a lot of different questions that came in that we just can't answer in an hour. And actually, we almost done in 5 minutes. But before we go, if you can just say just one thing, each one of you guys, whatever God puts on your heart, to plead with those who have not been vaccinated, or whatever God puts on your heart to say to those to make them understand more about that this thing is real. And we'll go after that, I promise.
I would say, if not for you, for others.
Yeah, I think my takeaway is, to kind of elaborate on that is, and I think someone said, I don't know, Dr. Dulan might have said something about your brother's keeper. It's not about me. I know I have a very, God willing, a great immune system. I'm rarely sick, praise the Lord. But the people you love, your parents, I have parents who are almost 70, it's your children, people you come in contact with. We become a world where it wasn't I, me, just what we would be so much better if we worried about our neighbor, or we worried about so many. It's not about you. So if you like, oh, I get it, I won't, but just be mindful that we could really turn this around and slow this down and stop replication if we just got vaccinated and boosted and followed CDC guidelines. And only thing I ask for people is do your own research. Don't Google. I want people to make educated decisions on their own volition. And that doesn't mean your friend, your sister, your cousin, your brother, Facebook, but just go to these websites, do some homework, read the data. And then I respect any decision you make past that, because it's an educated decision.
And just to add on to what she said, there are some people who, again, are fearful of getting the virus because they've had bad experience with, the vaccine. They've had side effects with vaccines. If it's your personal choice not to get vaccinated, do the other things that allow you to protect yourself. Like my husband said, it's still important to mask, to maintain the social distancing, to sanitize. If you're sick, stay at home. So if that's your personal choice that you choose not to, I believe the vaccine works. I've taken it myself. I've taken the booster, so I believe it's a way to help get this thing under control. But if you're one of those people, for whatever reason, you're against that, do the other things. I mean, it's just disheartening to see people out without masks to just say, I don't care if I expose someone. So do the other parts that you can help to less spreading the disease and to get it under control. Everybody wants to go back to normal, but you got to be willing to do something so that we can get to that point. And it's sad when you see that other people have to suffer and die because we're not doing our part. And that's the thing that's a lot of people are hurting over this thing, have lost close people, have seen people die in our practice. So it's real. It's not some conspiracy theory. We're seeing sick people. We've seen people that are die. We see people that are grieving because they didn't get to say bye to their loved ones. so we can work together on both aspects. I believe the vaccine works. Haven't heard of millions of people dying from the vaccine, but people all over the world are dying because they've gotten exposed to COVID.
Good takeaways, and I just echo the rest of the panel. You know, the vaccine, it is safe. You can have some side effects from it. They are minimal. Most people, it's 24 hours. We have a little fever, some aches, some things like that, but nothing compared to what you're going to get if you catch COVID.
Yes.
So I would say, you know, take it, but like Dr. Rosalind Dulan said, if you decide not to take it, protect others. If you feel sick, stay away, wear your mask, sanitize, like protect others, be your brother's keeper until we finally can get to the point where this virus is minimal. Will it go away? I don't know. We've had flu and flu vaccine forever. My feeling is that coronavirus is probably here to stay. Probably will get to a point where it's very minimal. We have some good oral antivirals and people are able to fight this thing off and not get as ill, but we are probably a ways away from that. So just staying diligent is what's important.
With the depression, again, it's okay not to be okay. It's okay not to be okay. And please say something, reach out. You know, you're feeling anxious, reach out.
Yes.
Reach out to God, reach out to your community, family, talk, say something, hit a wall, do something, make noise. It's okay not to be okay right now. So
Really deep because I've known kids in the Trotwood area and other areas that have tried suicide. And I don't want that to happen to any of our people. I actually had a young man who tried it 3 times, and the last time he was successful. So this is real. I thank you from the bottom of my heart. I thank you guys for being here. Like I said, we don't know what tomorrow holds, but we know that God can change all of this if he wants to. But right now we have to take care of ourselves. We haven't been doing that for a long time. It's time for us to mask up. It's time for us to get our vaccine. If you don't want to get the vaccine, like you said, protect those that you love. Do you love your mom? You love your dad? You love your sister and your brother? I've had both my brothers have had COVID. My grandkids have had it 3 times since they've been in Texas. I'm like, I don't want nothing to happen to them. You know, I haven't had it. God bless. If I had, I didn't know it. But I just want us to be okay. And I just want us to start loving on one another. I think if we start doing that, all the other things will fall in place. So thank you God again for being on, Dr. Michael and Dr. Rosalind Dulan, Miss Dorionne Whitaker, nurse practitioner, and Miss Dinah Callendar, nurse practitioner, psychiatric. I messed that up again.
It's okay. Just psych,
okay.
Nurse practitioner, psych, nurse practitioner. Yeah.
What she said. God bless you guys. I hope I didn't interfere with too much of the game.
Go Bengals.
Oh my Lord. That's a she's a bingo bitch like her mama. Oh my God.
I wore it.
Thank you again. Until next time on Testimonies and Praise, I'm your host, Jacqueline Moore, and I love you. Ain't a thing you can do about it. Until next time. God bless.